So we need to do urinary and reproductive. So first thing, you need to move everything away, off to the side. Here's the kidney. Located on top of the kidney, this little bump right here, that is the adrenal gland. You can see the renal vein coming in. So we need to cut through the kidney to see the different layers. So again, we're going to pick it up. Don't cut yourself. We're going to cut it in half. It doesn't take very much. It's not as tough as the heart. You're going to just simply lay this open. Look at that pretty color. Here's the cortex on the outside. Here's the medulla on the inside, a different color. And then right there in the middle, that is a region that we call the hilus. You can also see where the hilus is right here, the inner portion of the kidney where the veins and arteries are going to come in and out of. All right? So again, cortex, medulla. Adrenal gland located right up on top, that little nodule thing. Then we need to find the ureter. So the best way to do that is to use a probe or your forceps and kind of push down on the tissue, and you will see a very faint flesh-colored ribbon, and that is the ureter. So very fragile. It's usually embedded in some mesentery, and you can see that as I'm picking that up right there. It's a flesh-colored ribbon, and we can follow that all the way down to the bladder. Right here is the bladder. Not a very full bladder, so it's okay. And of course, this is a male, so we can see these bumpy wings. One here, right there. Those are the vesicular glands. That's what they're called in a rat. So vesicular glands. Right. So vesicular glands right here. Oh, that's right. Here's the bladder. Now, this particular male rat has an undescended testicle. So you can see this. You can see the scrotum right here. Here's the scrotum. Right here. Here's one testes, but the other testes is actually all the way up here. So when we open this up, we'll be able to see that, and we'll be able to push that down a little bit. Happens quite frequently, much more frequently than people realize, even in humans. If you have a male child and this occurs, they'll simply go in and release that tendon, and the testes will drop. So here we can see, and according to Mrs. Arterberry, none of the other male rats will make fun of him. Don't worry, it's okay. So here we can see where the urethra is coming out. So we'll have to expose the penis right there. So in order to do that, rounded side down, we're going to, gentlemen, take a deep breath. It's okay. We're going to take the middle of the scrotum. We're going to snip that. And we're going to open that sac up. Remember to pull up on your scissors so that you don't cut through anything else that you don't want to. We're going to lay that open a little bit, and you can still see some of that mesentery. So I need to make sure I cut through that a little bit. And now we can lay that open and take a look. And you can see this testes is actually up here when it should be down here. So that's what they would actually do in a human, right? They would actually release that tendon and allow it to come down here. So this is the testes. The epididymis forms up underneath and comes all the way up here, and you can see a large portion of the epididymis right here. Okay, so this is the epididymis right there. The vas deferens then. Vas deferens are running from this all the way up here. All right, so this tube right here is the vas deferens. That's going to carry the semen and come up where it will be added to from the vesicular glands and the prostate, which is sitting just underneath the bladder. So here's the bladder, there's the prostate up underneath there. Now, in order to see the penis, I have to expose that too. So I'm going to take the side of this, cut through just the skin layer so we can kind of expose the penis that's right there in the mesentery. I'm just trying to cut the skin in the mesentery.